So it's Tuesday morning. I'm here at Ready Medical Clinic in Wenatchee, and I'm here to get a COVID antibody test.
Doing okay?
Oh yeah, it's the poke and all that. I mean, that doesn't bother me. It's like looking at it.
So why don't you just like give me like who you are, sort of what your background is, like professional background or
Sure. Yeah. So my name is Sean Needham. I am a pharmacist and I own Moses Lake Professional Pharmacy along with my wife Janet, who's also a pharmacist. And we have been in business for almost 22 years now. And we've always tried to be proactive when it comes to healthcare instead of reactive. That's why we do a lot of with diet and exercise and prevention type stuff with hormone replacement to help prevent disease instead of having to treat disease. So that's kind of, a little bit of history with us being proactive in healthcare. I also am the host of a radio show called Health Solutions with Sean and Janet Needham, where every Monday we discuss everything healthcare on AM 1470 KBSN Moses Lake Station in Moses Lake. And also last December, I wrote a book called Sickened, How the Government Ruined Healthcare and How to Fix It. So, and that's kind of, I think, what brings me to talking about proactive when it comes to healthcare is that's what this antibody testing to me is about being proactive instead of reactive.
Okay. Yeah. Why don't you tell me like a little bit about the test?
So it's COVID-19. It's specific for COVID-19 antibodies. And, just a disclaimer, I'm a pharmacist. I'm not a virologist. I'm not an infectious disease specialist. I did learn a lot about viruses and vaccines in pharmacy school and have educated myself after the fact also. But I will, and I got to tell you too, that I am educating myself constantly on this subject, as you can imagine, because we're fielding lots of questions. So, and I just love to learn. So our bodies make up antibodies to many things. When it makes up antibodies to viruses, the body responds in with certain different immune modulators in the body. So the ones I'm going to talk about are IgM and IgG. That's what this antibody test tests for. And basically what it'll do is it tests specifically if you have the antibody AGG or AGM and it's an antibody to the COVID-19, that means you've possibly been exposed. Now, AGM, if it's positive, if it's really high and IgG is not, then that means you've been exposed in the last 7 to 10 days. If IgG is high and IgM is not, then that means you've been exposed within the last 30 days up to 3 years. So this will tell us if it's recent exposure or not recent exposure. And I just think that knowing the antibody test, knowing how many people have been exposed is a better tool than finding out who is positive for COVID-19, because I think that there's a lot of people that have been exposed and possibly immune now, and we're shutting the entire economy down with no real, if you look at most of our government officials, they have no real solution when they're going to open.
Right. Yeah. And I agree. I mean, there's something fishy going on. Like, why is it's not expanding, or why, stay at home. But if you really look around, there's a lot of people out, but the cases really aren't going up much. My gut feeling is that there is a lot of immunity out there, but I don't know.
Well, absolutely. And here's a couple examples. So fortunately, I'm a healthcare worker, so I've been labeled as essential for now anyway. And I have a lot of colleagues that are healthcare workers. And if this virus was so bad, then how come healthcare workers aren't getting it? How come it's not spreading through healthcare workers like crazy? Because even if you wear proper PPE, I can't imagine with the virus being aerosolized that it's not going to spread somewhat. Wearing a mask or not, it's going to spread somewhat because the virus lives on surfaces for hours after it's been off of an immune host, so, or of a host body. So I can't imagine healthcare workers wouldn't get exposed. So
Yeah,
And you don't see it, I mean, they're going to get exposed, but I can't imagine that it's not transmitting to them like, in the numbers that we would expect if it's so virulent and so bad.
yeah, like coffee stands. I mean, like every time I go to the coffee stand, it's just a line. Like it seems like a lot of people are getting coffee now, and you're not really seeing it there. Home Depot,
Walmart, whatever. Yeah.
yeah, and it's not spreading. So it makes, it's something doesn't seem right to me.
Well, and another thing too, I wanted to mention, Ben, is, and I talked about this on my radio show last week, actually, about herd immunity. And I know that, at first, when people started talking about herd immunity, there were some people that were raising their eyebrows and thinking, well, that's crazy. And what herd immunity is basically people actually exposing each other so we can spread the virus faster to get rid of the pandemic faster. Now, that might sound crazy, but if most of the healthy people don't get sick from the virus, one way to stop the spread of the virus, because you could argue that it's going to spread no matter what. So the more we shut down and the more we lock ourselves indoor and stop it from spreading, all we do is prolong the pandemic. So actually, social distancing healthy people at home could actually be prolonging the problem. And you could make an argument that the people that do need to be home, that are elderly or they're immunocompromised or they've already got underlying comorbidities, the healthy people are staying home with those unhealthy people. That's probably not good, you could argue. So social distancing healthy people could actually prolong the problem, and getting people out there could cause faster immunity.
Yeah, no, I agree. I've been saying, hey, we just need to get people sick, and the longer that this, because you don't know, there's a lot of the asymptomatics, and the asymptomatics, they're the ones that are actually going to spread. So the more that we get immunity, the less asymptomatic people out there, the less chance of giving it to a person who's at risk.
Yeah, that's exactly right.
So on this test, it checks the antibodies. If, say, I take it and I have the antibodies, what are my risks of catching it again? Do you think?
Well,
yes.
Ben, I am not an expert, so I'm not even going to comment on that.
Okay.
Because here's one of the things. There's chickenpox is a good example. There's some people that can get a secondary infection of chickenpox, and some people that never do. It might be a modified virus, possibly, but this virus is so new, we don't know if you're immune or not. But that being said, I think we have to be proactive and use something to get out there, so we can go to our government officials and say, look, let's just say we test 1,000 people, and 500 of them have been exposed and have either been sick or they never were sick, or they and they've already been exposed. We got to start getting the economy back to work, because I think we're doing a lot more devastation by keeping the economy shut down than we are by thinking this virus is going to be the next pandemic to wipe out the world. If we look at the numbers that were originally predicted in the United States you're already seeing. I think the number I saw numbers quoted by a government official that was 2 million people were going to die in the United States. Well, it looks like that number is off by about 100-fold. Right. I think we've had 20,000 people die. Now, I am not saying that one person is a lot. If it's your family member or it's your friend or something, that is a lot. But considering the numbers seem to be so far off, I think we would only allow the government to be off with that far of numbers and actually keep listening to them and stay in business. Now, again, I am not saying that we should not keep listening to what the government is saying, because they are telling us to social distance, and that's what we should do. But I want to be proactive and get some numbers out there that we can show people, so we can hopefully get this economy going as soon as possible.
Yeah, and I think actually saving lives. I mean, you look at the effect unemployment has on suicide, or like the food is all. When you're looking at how supply chains work, it's not like they can just shift it. Everybody's going to grocery stores instead of restaurants, that restaurant might buy a 20-pound case of cheese. Well, now nobody's buying 20-pound case of cheese. They're buying the little packets, but they're buying a lot of them. Well, there's only so many packaging lines that can then make those.
Right.
And so now you've just got all this milk that they're dumping because they can't package it or process it. Just, we're not set up. And when you totally throw it out of whack, we're going to waste a lot of food. The other question is, are we going to have enough migrant workers to come up here? Wenatchee Valley. I don't know. I'm not saying this that I know, but you have to question whether we're going to have the people up here to work on the farms that we normally do. And is that going to affect the world's food supply? It could potentially throw it way off and could potentially kill way more people.
Yeah, those are actually great observations and great questions. I don't know if we're allowing the border, migrant workers to come across the border or not. I'm not really sure of that.
Well, and the migrant workers might be afraid to come and want to just stay home.
That's a good point.
So I'll give you, we'll almost play like a little game. I'll give you a little bit of like my sort of health history, and we'll sort of make a guess, a random guess, maybe like a percentile of whether I have the antibodies, just going off that. Is that fair?
That's fair. I can honestly tell you that's a big guess. I don't think
it's a very big guess.
Yeah, I don't think the most experienced infectious disease doctor on this subject could answer that. But go ahead.
So, like a couple things. I went to Japan, which is obviously closer to China, where they said this started. I was in Japan the first week of November. Let's see, no one was sick right after that. And one person who was on that Japan trip did come down with COVID about a month ago, actually tested positive for it. So I don't think I got anything there. That'd be my guess. And in December, I would consider myself fairly healthy, pretty good immune system. It was about December 15th, like the worst flu I have ever had. I remember, it was about like probably 6 days. And like, I couldn't get out of bed to answer an email. Like I would do about one email a day. And I'm telling you, by the end of that email, just writing 2 sentences, I'm done. I'm back to bed. I don't remember exactly what it was like. It was like the flu, whether or not it was a dry cough or, I don't remember a lot of mucus though. So I don't remember a lot of mucus, but yeah, I was super weak in bed and like I said, like, I just remember saying, this is the worst. I've never been so sick. And like I said, one email and I was back to bed the rest of the day. I haven't been sick since, or any definitely no fever or anything. I would consider myself definitely more out in public and more interaction, like sort of a low fear type of person. So I've definitely had a lot of interaction, definitely more than average the last month or so, while some have been sheltered in place. I did that a little right when it first came out. I was pretty conservative, but I was definitely out more than the average. So I'm going to say that I'm going to go like 90% I do not have it, the antibodies. That would be my guess.
Yeah, well, I mean, there again, I really can't predict. I can tell you that I have a handful of friends or patients that have said, back in December or early January, I got really sicker than I ever did, and they had symptoms that could be COVID-19. But remember, there's a lot of different respiratory symptoms and the like that cross over. So, we can't predict unless you test, and that's why we're testing. So,
okay. Yeah. That's definitely been there was like that sickness. A lot of people that I have heard, out like mid-December to early January were very sick. And a lot of people have said like it was their worst. They've been sick. And I mean, I remember telling people like, this is the worst I've ever been sick. And that's what I think, and that's sort of why I want to do this, is sort of like dispel that, maybe 1% a little bit, just throw in that grain of sand. Or maybe it's like, okay, if I do have the antibodies, maybe that was it. We can't say with definition, but, and I will say I follow a guy on YouTube, and he just did the antibody test a couple days ago, and he was talking about that, how sick he was. And his antibody test, he did the blood prick one, and it was like a pretty instant test. It was like 15 minutes, and he tested negative. So that test said that he didn't have the antibodies. And I guess we can talk about tests. Like, I don't know, there's a couple out there. What do you know about like tests out there?
Like I said, I'm learning as we go through this process, but I will tell you this. So one of the things is that, our pharmacy at Moses Lake Professional Pharmacy, we're going to use our space as a place to draw blood. We're actually working with a clinic out of East Wenatchee called Ready Clinic, Ready Integrative Clinic, and they're out of East Wenatchee. And Carl Lambert is the CEO of that clinic, and it was his idea, a week and a half, maybe 2 weeks ago, to do this antibody testing. And of course, he's offering it in the Wenatchee area, and he contacted me and was wondering if we would want to use Moses Lake Professional Pharmacy as a site. Of course, I was all over it, being somebody that wanted to be proactive about this and get our economy back to work. So, because I didn't like the way the COVID-19 positive tests were driving this event anyway, because it just seems like, oh yeah, well, we had, X number of people test positive again today. Well, yeah, that's fine. But, what about people that have never been tested and might have already been exposed? So that's kind of why I wanted to do this. So I was more than willing, when Carl reached out to me, to use Moses Lake Professional Pharmacy as a site. And we're doing it Thursday, actually. And we were taking 4 patients every 15 minutes. And we've only got 25 slots left. So we've got over 100 people already signed up that are going to do the test. And we have 4 different sites in our pharmacy that we can draw blood. So I'm super excited about that. And
do you know how available these tests are? Like, does he have like thousands or?
He just started doing this last week. He got his first test last week. And he ordered more to because of demand. But let me talk a little bit about the specifics of this test, which I do know, and I don't necessarily know about, XYZ test, but I will tell you what the CEO of biotech, of US Biotech Labs said. Those rapid tests that are, that you get fast results, they're not as specific, and they're not as accurate. So from what he says, they might show false negatives, and that might be worse than even having a test at all. So, and his comparison was like, they are like an over-the-counter pregnancy test. They need to be inexpensive, and they need to be fast. So they're definitely not as accurate as it would be if you took a blood test. And the test that Ready Medi is doing at our pharmacy is more specific to the COVID-19 antibodies, is what the CEO told me.
Okay. And you have to draw blood to do this, it sounds like.
You do. There's a specific kit along with it, and they have to do a blood draw. They send it off to the lab. It'll get there next day, and then the lab has the results within about 48 hours after they receive it. So we should start seeing results first to middle of next week. Okay.
And I'm actually going to get tested tomorrow in Wenatchee, so I might have them the end of this week.
Yeah, cool.
And what's the cost? And do you know if like healthcare will cover it? Insurance?
Well, I'm not familiar with the health insurances. There's so many out there. I'm not up on that. Also, Ready Medi Clinic is like Moses Lake Professional Pharmacy. We don't bill any insurance, and one of the reasons we don't bill any insurance is because it allows us to offer the best possible price and the best possible service to our patients. So the cost of this test is $155, and there are no surprises there. You pay $155. You're not going to get a bill later for $1,000 saying it was supposed to be covered and it wasn't. And that's one of the problems when we get into health insurance billing is sometimes they say those things are covered, and then when they're not covered, of course, the healthcare provider has to increase the billing on the test because it increases the cost, and then so they'll bill 4 or 5 times what they should have in the first place. And then when the patient gets the bill saying it wasn't covered, they're upset. So that's why I just recommend paying out of pocket, and then there's no surprises.
Okay. I think that's about all I have. Do you have anything to add or?
No, I guess I just want to say that, call Ready Medi Clinic in East Wenatchee and set up an appointment if you're in the Moses Lake area or you're in the Wenatchee area. Call them, Ready Medi Clinic. They're on the Ready Medi. Just Google Ready Medi Clinic in East Wenatchee and they will come up. Call them and set an appointment up. Tests are going fast. There's kind of a limited supply, and the more we get this out, the faster they're going to go. So I think the main thing is I just like the idea of being proactive with this, so we can see how fast, we can show other numbers to our government officials to show, why we should get the economy going, because I don't think what we're doing now seems to be working.
Yeah, I agree. Yeah, and of course, anything I will share with you my results, so you can use those, and
yeah, absolutely.
Hopefully others share their results too, and yeah, we can all make informed decisions from that.
Yeah, I'm hoping to tally all the results and post them on my Facebook just to show people so they can kind of follow the numbers that we're seeing. Obviously we'll keep all the data, patient confidentiality, but just to show the overall numbers. Cool.
Well, yeah, I appreciate it, Sean.
Yeah.
And definitely a lot of good information.
Yeah. Well, thank you for having me, Ben. I really appreciate you reaching out to me, and keep in touch and let me know how what your test says.
Yeah, we'll do.
Okay.
All right. Thanks, Sean.
Thank you.
So last Tuesday, I took the COVID antibody test. Today's Tuesday, so it took 1 week to get those results in. They just got emailed to me. I have not read them. I have not seen the results. So and all this says, this is not a test of whether or not I have COVID. It is whether or not I have had it in the past, and potentially less likely, if I do have the antibodies, theoretically, I'm more immune to it and less likely to be a carrier or less likely to get sick. So I have not seen it. Obviously, I'm hoping that I already had it and potentially don't have to worry about it down the road. Or, if I was to get it, maybe it'd be less sickness. I'm not a doctor, so I'm not giving any doctor advice. You could do more research. So I am going to open the email and see. Non-negative. So non-reactive, non-reactive. So I got the results, non-reactive. I read exactly what it means. So what it's saying is that I probably have not had the COVID virus. So those of you, like I had said earlier, I was super, super sick there in December. Like probably the worst flu I've ever had. Maybe, it looks like that was just the flu. So I'm just trying to give a little bit of information out there, what has happened to me and what the results are. So I was super sick there in December, and it doesn't look like, in my case, that was COVID. So like I said, it says currently I have not had it. So still out there, but I am out and about quite a bit and have not caught it. So yeah.